Stroke is a major medical emergency. It can cause lasting brain damage, long-term disability, or even death. Every second counts when it comes to treating a stroke. Quick and effective treatment can save lives and improve recovery outcomes. Strokes are a leading cause of death and disability worldwide. They place a heavy burden on patients, families, and healthcare systems. An acute stroke disrupts blood flow to the brain, depriving it of oxygen and nutrients. This can cause brain cells to die within minutes. The impact of a stroke is profound. It affects not only the patient but also their loved ones. The healthcare system also feels the strain due to the need for immediate and intensive care. This is why rapid response and adherence to protocols are crucial. Understanding and following stroke management protocols can significantly improve patient outcomes. Medical professionals must be well versed in these protocols to act swiftly and efficiently. The Cincinnati Pre-Hospital Stroke Scale, or CPSS, is a simple and effective tool. It helps in early identification of stroke symptoms during the pre-hospital phase. EMS personnel use this scale to quickly assess patients for signs of a stroke. CPSS focuses on three main signs: facial droop, arm drift, and speech abnormalities. If any one of these signs is present, the likelihood of a stroke is high. This quick assessment can lead to faster transport to a stroke center, where specialized care is available. Facial droop is tested by asking the patient to smile or show their teeth. Arm drift is checked by asking the patient to close their eyes and raise both arms. Speech is assessed by having the patient repeat a simple phrase. Early detection using CPSS can significantly reduce the time to treatment. This can improve the chances of a full recovery and reduce the risk of severe disability. EMS protocols play a critical role in the management of stroke patients. These protocols ensure that patients receive timely and appropriate care. One key aspect is the rapid identification and transport of stroke patients to specialized stroke centers. Stroke centers are equipped with advanced diagnostic tools and treatments. They have teams of specialists trained in stroke care. Transporting patients directly to these centers can improve outcomes significantly. EMS personnel must follow strict guidelines when dealing with suspected stroke patients. This includes using tools like CPSS and quickly transporting the patient to the nearest stroke center. Communication with the receiving facility is also crucial to prepare for the patient's arrival. Timely and efficient EMS protocols can make a huge difference. They help in reducing the time from symptom onset to treatment, which is critical for stroke patients. In the emergency department, time is of the essence. The goal is to assess and treat stroke patients as quickly as possible. There are specific timelines that healthcare providers must follow to ensure optimal care. The first step is a rapid assessment within 10 minutes of arrival. This includes a neurological exam and medical history. A CT scan should be performed within 25 minutes to determine the type of stroke. Results of the CT scan should be interpreted within 45 minutes. For ischemic strokes, fibrinolytic therapy should be administered within 60 minutes of arrival. These timelines are crucial to minimize brain damage and improve recovery. Strict adherence to these timelines can save lives. It ensures that patients receive the right treatment at the right time, reducing the risk of severe complications. Patient assessment in the emergency department is a critical step. The first priority is to stabilize the patient's vital signs. This includes checking blood pressure, oxygen levels, and heart rate. A detailed neurological exam is conducted to assess the extent of brain damage. This involves checking the patient's level of consciousness, speech, and motor functions. Blood tests are also performed to rule out other conditions that may mimic stroke symptoms. Immediate actions include starting intravenous lines and administering medications. For ischemic strokes, fibrinolytic therapy may be initiated. For hemorrhagic strokes, efforts are made to control bleeding and reduce intracranial pressure. Prompt and accurate assessment is essential. It guides the treatment plan and ensures that the patient receives the necessary care without delay. Fibrinolytic therapy is a key treatment for ischemic strokes. However, not all patients are eligible. There are specific criteria that must be met to safely administer this treatment. Patients must be within a 3 to 4.5 hour window from the onset of symptoms. A thorough medical history is taken to rule out contraindications such as recent surgery or bleeding disorders. A CT scan must confirm the absence of hemorrhage. The patient's age, weight, and overall health are also considered. Fibrinolytics work by dissolving the blood clot that is blocking blood flow to the brain. This can restore circulation and minimize brain damage. Adhering to these criteria is crucial. It ensures that fibrinolytic therapy is administered safely and effectively, improving the chances of a positive outcome. Understanding the differences between ischemic and hemorrhagic strokes is essential. These two types of strokes have different causes and require different treatments. Ischemic strokes are caused by a blockage in a blood vessel supplying the brain. This can be due to a blood clot or a buildup of plaque. They are the most common type, accounting for about 87% of all strokes. Hemorrhagic strokes occur when a blood vessel in the brain ruptures. This leads to bleeding in or around the brain. They are less common but more deadly. Causes include high blood pressure, aneurysms, and head injury. Accurate diagnosis is crucial. It determines the treatment plan and can significantly impact the patient's recovery and prognosis. Treatment options vary depending on the type of stroke. For ischemic strokes, the main goal is to restore blood flow to the brain. This can be achieved through fibrinolytic therapy or mechanical thrombectomy. Fibrinolytic therapy involves the use of drugs to dissolve the blood clot. Mechanical thrombectomy is a procedure where a device is used to physically remove the clot. Both treatments are time-sensitive and must be administered quickly. For hemorrhagic strokes, the focus is on controlling bleeding and reducing pressure in the brain. This may involve surgery to repair the ruptured blood vessel or remove the accumulated blood. Medications to control blood pressure and prevent further bleeding are also used. Each treatment has its own risks and benefits. The choice of treatment depends on the type of stroke, the patient's condition, and the time since symptom onset. Rapid response and competent care are vital in improving stroke outcomes. Advances in medical technology and research are continually improving stroke care protocols. Future improvements may include better diagnostic tools, more effective treatments, and enhanced EMS protocols. One area of focus is the development of portable imaging devices. These could allow for quicker diagnosis in the field, speeding up the treatment process. Another area is the use of telemedicine to provide expert consultations in real time. Continued education and training for medical professionals are also crucial. Staying updated on the latest protocols and treatments can save lives. The future of stroke care looks promising, with ongoing efforts to improve outcomes and reduce the burden of this devastating condition. Thank you for watching this video created by the physicians of AffordableACLS.com.